Welcome back to our channel. Today we're going to talk about the anatomy of carpal tunnel syndrome, a common hand condition often characterized by numbness, tingling, burning, and pain in our hands. We'll break down what carpal tunnel syndrome is and how it affects your hands and wrists. As always, this video is informational and not a substitute for an evaluation by a qualified medical professional. I'm Dr. Travis Peterson, a board-certified orthopedic surgeon with subspecialty certification in hand surgery. I've helped thousands of patients find relief from their symptoms of carpal tunnel syndrome. Let's get started. Carpal tunnel syndrome, or CTS, is a common group of symptoms like hand numbness, tingling, burning, and pain, which is caused by compression on the median nerve as it passes from the forearm into the hand through a narrow opening or passageway in the wrist called the carpal tunnel. To understand carpal tunnel syndrome better, let's take a closer look at the anatomy of the wrist and what's happening in your hand with carpal tunnel syndrome. The median nerve. The median nerve is one of three major nerves that extend into the hand. It passes through the forearm, through the wrist, and into the hand, branching out to the thumb, index finger, middle finger, and half of the ring finger. The other half of the ring finger and the small finger are provided sensation by a different nerve called the ulnar nerve. It travels around the elbow, down the forearm, and through the wrist, but not through the carpal tunnel, and then branches out to the small finger and the other half of the ring finger. In carpal tunnel syndrome, the median nerve is getting compressed as it passes through the wrist in the area called the carpal tunnel. This pressure on the nerve is irritating to the nerve. When symptoms occur on this side of the hand, that is often a result of carpal tunnel syndrome. When the symptoms affect the ulnar side of the hand, that is often what we refer to as cubital tunnel syndrome. The symptoms. The median nerve carries both sensory and motor fibers into the hand, and both of these can be affected by the compression on the median nerve. The nerve does not like this pressure, and it tells us it's unhappy by giving us numbness, tingling, burning, and pain. Where do these symptoms occur? Well, most commonly they occur in the area supplied by the median nerve, including the thumb, index finger, middle finger, and half of the ring finger. Symptoms can be felt in all of these fingers or in some combination, and can even often feel like they affect the entire hand. These symptoms are often brought on or made worse while we sleep at night, or with daytime activities such as driving, typing, writing, doing hair, or various other daily activities. Other symptoms commonly reported include hand weakness, aching, frequently dropping things, or difficulty with daily tasks requiring dexterity or repetitive movements. The carpal tunnel. The pressure on the median nerve in the carpal tunnel occurs where it passes through a narrow passageway in the wrist called the carpal tunnel. This passageway is formed by the bones and the ligaments of the wrist. In this diagram, you can see that the median nerve and the flexor tendons to the fingers pass underneath a ligament called the transverse carpal ligament. A cross-sectional view of the wrist at this point shows the median nerve and those tendons passing through an opening formed on three sides by the bones of the wrist, and the roof or the top of that opening is the transverse carpal ligament. The bones and the transverse carpal ligament form the opening or the passageway through which the nerve passes to get from the forearm into the hand. This passageway is the carpal tunnel. So if you have a hand and a wrist, you have a carpal tunnel. But that doesn't necessarily mean that you have carpal tunnel syndrome. Carpal tunnel syndrome is the numbness, tingling, burning, and pain you feel as the nerve is getting compressed as it passes through the carpal tunnel. It is helpful to understand that all carpal tunnel syndrome is not the same. Some patients have very mild carpal tunnel syndrome, and some have very severe. Most fall somewhere between mild and severe. It is important to understand the severity of your carpal tunnel syndrome, because understanding that severity will help us to make good decisions about treatment and can help us to have appropriate expectations about treatment and success. The severity of your carpal tunnel syndrome and its impact on treatment and outcomes can best be assessed through a full evaluation by a qualified medical professional. Early evaluation and management generally leads to the best outcomes and helps avoid the problems associated with nerve damage and permanent numbness and tingling. Patients frequently ask, what is causing the compression on the median nerve? While there are several potential causes of compression of the median nerve, ranging from swelling and inflammation to wrist injuries, arthritis, and even underlying medical conditions like diabetes or thyroid disorders, In many cases, the cause is idiopathic or unknown. Research is ongoing to try to better answer this question. Diagnosis. If you suspect you have carpal tunnel syndrome, consult a healthcare professional. They will review your medical history and perform a physical examination. In some cases, additional testing, like a nerve conduction study with or without electromyogram, can help confirm the diagnosis. We'll talk more about diagnosis in subsequent videos. The good news is that carpal tunnel syndrome is treatable. Depending on the severity, treatment options may include the following: rest, stretching, and modification of hand activities, wrist splints while sleeping at night, anti-inflammatory medications, corticosteroid injections, carpal tunnel release surgery. In summary, carpal tunnel syndrome is a condition resulting from pressure on the median nerve as it passes through the wrist in an area called the carpal tunnel. Understanding its anatomy, symptoms, causes, and treatment options can help you take better care of your hand health. If you found this video helpful, please give it a thumbs up and consider subscribing so you can receive additional helpful content. If you have questions or want us to cover specific topics, please leave a comment below. Thanks for watching, and we'll see you in the next video. Until next time, take care of your hands and stay well.